Yeah, so my name is Lilianne Ploumen. I work with Bureau Clara Wichmann and with Human Rights in Practice on strategic litigation on issues of gender rights and human rights in general. I have been a Minister of Development Cooperation and Foreign Trade of the Netherlands. And I'm a feminist activist, which I've been as long as I can remember. And this is my first time in Malta, I mean, stunned by the views and by the beautiful buildings and the cathedral. I went there, I'm here by invitation of the Dutch embassy, the embassy of the Netherlands, to engage in a dialogue on sexual and reproductive rights, which has been one of my rallying points. So you could say bodily autonomy has been there for many, many years. So.
My name is Professor Isabel Stabile. I am a pro-choice gynaecologist. I'm also an academic at the University of Malta. I'm happy to be here today because I've been honored with an award called the Embassy Tulip Award from the Embassy of the Kingdom of the Netherlands for the work that my colleagues and I have done. Yesterday was Human Rights Day, as it happens, and the work relates to our campaign to decriminalize abortion, as well as promote comprehensive contraception and sex education, of course, in schools.
What was your reaction when you discovered that you were being awarded with this?
I was totally shocked. It was a complete surprise. I had no idea that this was even possible. I had no idea why we were actually meeting. I did. We were meeting to plan Ms. Ploumen's visit to Malta. And the ambassador just, told me that she'd made a request. Apparently, there's quite a competition for these awards. They only offer 5 in the world. And this is the first time that the embassy in Malta has ever competed, if you like, for that. And they said they were very pleased that their request was acceded to, and especially because, generally speaking, these awards apparently go to, foreign countries outside the EU. But this is the first time that a person within the European Union, where you would expect human rights to be far better, in fact, it points out that we are severely lacking on this island in terms of human rights for anyone who can get pregnant. And this is a challenge that we need to continue to fight.
Absolutely. Congratulations for the award.
Thank you.
So like you said, you're a pro-choice gynecologist in Malta, and you have been for quite a long time now. Have you ever felt any repercussions on your career for your vocal stones?
From the point of view of my clinical career, I've got a private practice. The answer is no. If anything, I would say that being pro-choice has actually increased my audience, my clients. People nowadays, especially younger people, actually will seek out a doctor who is pro-choice, even if they are not interested in abortion specifically. They just want to be able to speak to someone who's more open-minded. So from a clinical point of view, I would say no, not at all. There have been some repercussions from an academic point of view. I have moved from the Faculty of Medicine to the Faculty of Dental Surgery. I wasn't very welcome in the Faculty of Medicine, and that's fine. I feel that I'm in a much happier and frankly better place.
Do you think that there are many gynecologists and local doctors who subscribe to your same mentality but are afraid to say it?
Yes.
Or is it a case of traditional disinformation is still very deeply ingrained in the health sector?
Yes, I think it's probably both, okay? So there are a handful of gynecologists, mostly female, who are pro-choice, okay? Personally pro-choice. And by the way, this extends to GPs as well, okay? Specialists in family medicine who are definitely pro-choice. And they are, in fact, referring to myself and my colleague, Dr. Isabel Stabile. They do refer to us because they realize that we're both pro-choice. For some reason, and reasons that we will never know and we obviously respect, they don't feel they themselves can come out and say so. But they will always refer. Having said that, unfortunately, some of my older colleagues, I shouldn't say that because I'm actually quite old myself, I'm 67, but some of the colleagues my age are much more conservative. And for their own reasons, which I do respect, and they are very anti-choice. And this is obviously a problem.
So,
The reason it's a problem, if I may say, is this. It's quite simple, really. Abortion is healthcare. So there's nothing complicated about this. This is a medical procedure. And it has, therefore, to fit within a medical framework. It's unbelievable and inconsolable that in fact, medical students in Malta are not taught anything about abortion. And remember, we are making doctors for the world. We don't just make doctors for Malta. So we need to do better.
so speaking on doctors and pro-choice, have you heard of cases in Malta where women have actually been criminally charged for having an abortion because they were reported by their doctors?
Yes.
Yes.
Yes, unfortunately, yes. There is one case going through courts at the moment on those lines, and another that we know of quite recently who was not reported by a doctor but by another healthcare professional. This is unfortunately a result of misinformation or misunderstanding about mandatory reporting. There's confusion about this. It is not in fact the case that one needs to report an abortion. But the interpretation seems to focus on whether this person is a risk to themselves or to others. The others has been, encompasses in their view an unborn fetus. Okay, they will call it a baby, they will call it a child, let alone the fact that legally a child is so called at birth. Okay, there's no legal persona in a child until that child is born. So it makes no sense. And the courts are very clear about this, but people are not. And therefore, there is a misunderstanding of what they can and cannot or should not report. Mm-hmm.
So yesterday, the Health Ministry
Yes.
came out with the updated, launched a public consultation of the sexual health strategy. What is your take on it?
My take on it? Well, it's 12 years late, but we're glad we have it because better late than never is always a good idea. Having said that, I do feel, I do have some concerns. I'm glad it's there. Okay, I'm glad we have a starting point. We were, however, told that its implementation would be over the next 6 years. And it would depend, of course, on the resources that become available, which therefore means that we don't have something that will, in fact, for sure, meet reality. That is sad. I had expected to see action points with timelines, with preferably dollar amounts, euro amounts associated with it, perhaps not, because that's a private issue that they may wish to keep confidential, but certainly timelines and persons responsible for the actions. In other words, a proper action plan. That's the only way you can convince people like me that this is actually going to happen at some point. Now, having said that, they have guaranteed that it will roll out one step at a time. We don't know which steps will be taken first. The contents are interesting. I would have liked to see a lot more. Like what? Well, there's mention, for example, in the research that was done. I must take my hat off to the ministry because they did actually commission some research to inform their decisions. And this is very wise. This is the previous Minister of Health. Very, very wise. And that data is out there. And some of the data, for example, tells us that people in Malta actually are now in favor of the decriminalization of abortion. So we found it very strange that this was nowhere mentioned at all, as though it doesn't exist. What was mentioned, and is obviously of importance, is, for example, the availability of free condoms. But this will only be to people over the age of 16. As though, 15-year-olds are not having sex in Malta. It doesn't really make sense. When challenged on this issue, the response was, well, we need to work within the legal framework. Well, that may be true, but the reality, of course, is that if we think of other illegal activities like drug abuse, like drug use, we provide free syringes, right? We don't say, well, it's against the law and therefore we won't do anything. We do what is in the best interest of the person who is abusing. And that's the right thing to do. So if we truly want to have as few abortions as possible and few unwanted pregnancies as possible, then surely what we need to do is to provide free contraception straight away to anyone who might need it. And really and truly, this is not an expensive enterprise. In case I don't know if you're aware, but Doctors for Choice provides free condoms. Okay, you just go to our website. Well, we do ask for a nominal fee, which we always waive because people say they can't afford it, so we will waive the fee. But you know, we can provide condoms. Why not the Ministry of Health? Yeah. So going back to what did I think of the strategy, I think it's not a strategy. I think it's a wish list, a nice wish list. I wish it were bigger. I wish it were wider. For example, one of the points they made, which is very valid, is the availability of the morning after pill on the formulary. This is very, very important, and we're very glad that this has made the cut, as it were. So being available on the formulary means that women can obtain it more easily. Right now it's available without a prescription, but you need to pay for it. And the cheapest that we have is about 30 euros. So you can imagine, you know, a 15, 16-year-old who's had unprotected sex, who is wise enough to want to protect herself from pregnancy, may not have the money. I'll give you another example, which is an egregious example, but it's really true. A woman who's raped and who presents to the casualty department at the hospital will be told, after she's examined and looked after from a medical point of view, she'll be told, go and get the morning after pill, because it's not available on the formulary. Now, you will hear the government tell you, the ministry tell you that, but it is available on the ward. This is true. This is true. It is available on the gynecology wards through a donation from the company. However, the only women who are raped or girls and women who are raped, who are admitted to the ward are those who are with serious medical problems. Generally speaking, they're not admitted. So the reality is that these young people have to go and find the morning after pill, sometimes on a weekend, sometimes on a Sunday, sometimes in the middle of the night. I mean, it doesn't make sense. So I'm very happy that this is now finally going to make the cut. I would have very much preferred to see some mention of abortion because the reality is that 500 women plus or minus are having abortions every year in Malta, and we are simply ignoring that fact. So what we're asking for is, let's decriminalize this. We're not saying legalize it. We do realize that that's a much bigger step, although I would like us to go there, okay? Preferably before I die. But at least a baby step. A baby step. Make it easier for these women to seek medical care when they need it. Make it less likely that they will be afraid to actually go to Mater Dei because they are afraid that they might be reported. And we know that women have been.
I'm going to ask Dr. Lilianne Ploumen, what are your thoughts on Malta's abortion laws?
Yeah, well, in general, and that applies also to Malta, I do think that abortion should be criminalized, that we should look at it as from the point of view of healthcare, because it is healthcare. And I do think that, for women in Malta who want an abortion, who need an abortion, it's very difficult to get one. And I think giving people access to abortion and to sexual and reproductive health in general in 2024, should be a given, basically. So, so also in my country, of course, there's debates and dialogues and laws can improve. But the criminalization here in Malta of abortion of both women as well as healthcare providers, I don't think that is helpful, because abortions happen. I mean, if you have a ban on them, that doesn't mean that they're not happening. On the contrary, data from all over the world show that the countries who have the less restrictive laws have also the least number of abortions, and that is true for my country, for example, also. And so I think that is, yeah, and I would wish that Malta has also such a legal framework, yeah, and such an accessibility to this healthcare, well, to abortion as healthcare.
Yeah. Can I ask you just very quickly? The mic is rolling down.
Oh, yes, like this.
Perfect. Yes, please.
Okay.
Perfect.
Do you think it stays there? Yeah.
Yeah.
Yeah. Now it does. Yep.
It's got a red, I can see it's red, that's
Okay,
why. Is
and
that
that's-
okay?
that's okay.
Underneath is green. Both sides are red.
Well, as you
Okay,
can
because
see.
I can see red with you.
Okay, I can see your red too. Sorry.
So earlier today you met with our Health Minister Jo-Etienne Abela. I'm curious to know about the discussion. Is there anything you can share?
Yeah, it was a very interesting conversation. We obviously talked about the new strategy that was presented yesterday, and I shared some of the insights of the Netherlands, where, for example, comprehensive sex education is part of the curriculum. Age appropriate, obviously, I mean, I'm just mentioning, but of course it's age appropriate. And I also, I think it was very important to mention that that it's not so much about being for or against something, but that it's really important to make sure that everyone has access to the healthcare services that they need, and abortion being a healthcare service. And so, and we talked about the implementation of the strategy, obviously, and the plans that the ministry has, as well as the importance of engaging experts, NGOs throughout the process. And so, in the Netherlands, that kind of consultation is very important. And I also mentioned to the minister that, I mean, we have our legal framework on abortion has been there since 40 years, but very regularly we do an evaluation of the way that the law works is done. So every, I don't know, maybe every 5 years, I think it is. It's done by an independent panel of experts, and it is discussed in Parliament to assess, is this law working in the way that we think it works? I mean, that's one thing, is having a good legal framework, and the other is everyone who needs an abortion also able to access the services that go with that? And so, so it's good to have a strategy. That was my, that's what I mentioned to the minister. And it's also very important to evaluate. And I found it quite interesting to read in the strategy that, so there's this large group of Maltese people that say that they are in favor of decriminalizing abortion, which I think you also mentioned. And to me, that seems a good opportunity to open the discussion and have a dialogue with one another on the issue. And again, the essence of the matter is choice. I mean, I don't judge any choice any woman makes. I mean, it's for her to decide. And I see that in the Malta context, it's quite difficult to make a choice because not all choices are like available to you. And yeah, so I mean, obviously the Maltese context and the Dutch context are quite different. But I do hope that the conversation, was useful to the minister. We also, I could not bring Dutch material on comprehensive sex education. I mean, I could bring it, but it would not be very useful because no one could use it. So I brought the minister a book from Malta in Maltese and English. That was, my understanding was that it was to be distributed, but that at the Ministry of Education, they did not, agree to that. But I presented it to him because I think it was a good way to introduce like maybe a more standardized way of talking about sexuality in Maltese schools. So so I think he found it interesting. So yeah.
Well, do you know the name of the book by any chance?
Yes, I think it's My Fantastic Body.
Yeah.
Okay.
The author is Dr. Isabel Stabile.
Oh,
Yeah.
yes.
Yes.
Yeah, and it's in 2 languages,
It's in
which
2
is also
languages.
very interesting.
Yes, it's actually the only book we have in Maltese on the subject. There are, as you know, I mean, sex education in schools is very, shall we say, patchy. So some schools follow a curriculum. The Department of Education does have a curriculum. However, it's not implemented uniformly. That's for government schools, but that's state schools. But unfortunately, independent schools and certainly church schools are free to do whatever they like. So unlike math, English, French, German, whatever, all those sort of standard subjects where the curriculum is fixed. There's a national curriculum. This is what you need to learn across the board. This is not the case. So we hope that this book could be of help, and we would like to see it in schools. It's not a standalone book. I mean, the idea is for it to be read with a guardian, with a parent, with a teacher, to sort of guide the conversation. And there is no mention of abortion in this book. Okay, I want to be very clear. None whatsoever. It's aimed at 10 to 13-year-olds. So we don't talk about abortion to 10-year-olds. We talk about consent. We talk about respect. We talk about their body. We talk about contraception because they will eventually need to use contraception. So they need to know what's available. And one of the things we've noticed through our family planning advisory service, our helpline, and also the doula support service, is that when women call us, it's amazing how little they know about their bodies.
Yeah.
And this is unacceptable. We're talking about 40-year-olds, 50-year-olds, well, maybe not 50-year-olds, but who have no idea how to calculate whether they're pregnant or not, when they might have got pregnant. What happens if I take the morning after pill? Do I need to take the morning after pill? I mean, it's just incredible lack of knowledge. And one of the things we hoped for through this book is that actually parents would learn something through their own children. It's not, this works. Pedagogically, it actually works. You can teach parents through children.
Yeah, well, and also, I mean, it helps the conversation because it can be a very uncomfortable conversation, about sex.
Yes.
And then it helps if you have like a book that can guide you and maybe can answer some questions that questions your children have that you don't know yourself how to answer exactly. So I think it's always a good idea to have that kind of information.
I think it's also very important to use the correct language because the one of the problems, as you say, it's an uncomfortable subject, or it can be an uncomfortable subject for some. And if we don't use the correct language, if we don't talk about a penis, if we don't talk about a vagina, and if we don't talk about orgasm and so on, I mean, how can we then communicate?
Yeah.
How do we communicate about what's normal, what's acceptable, what is legal?
So back on your conversation with the minister, because you mentioned that he brought up an abortion, and let me know if I'm overstepping, but I'm curious to know how this was received by him, and if he, I don't know, maybe outline some specific challenges as to why he doesn't try and implement it, or he's a bit quiet about abortion.
Yeah, so I'm not going to speak for the minister. I think that's up to him. But I can say, of course, I mean, there have been some legal changes recently in Malta, which I would consider to be, instead of like the end of a conversation, I would really encourage everyone to make that the start of a conversation on what kind of legal framework do we feel is appropriate, and also helps the government to come up with its obligation to provide healthcare for all its people. And so I do hope that it's a start of a conversation instead of thinking that by now everything is as it should be, because many women are in situations that, you know, might not be lawful, strictly speaking, but where you feel that, you know, abortion needs to be accessible to them. So, and here also, to me, it's, so there's two conversations to be had, obviously, because I feel, I mean, bodily autonomy is like a right, and the other side of the coin is that it would be good if we would be able to share stories about abortion, that women would be able to share, you know, if they had an abortion or how difficult it was to get one because they had to travel afar, how they felt, because now it's also a very lonely experience for many women. And I think if it could be approached with more compassion and from a healthcare perspective, that would really help the conversation. It's really important to, well, open up to one another.
Yes. So on those lines, actually, and maybe we will now make a present to the Minister, a Christmas present. We do have such a book. It's called Dear Decision Makers, and if I had a moment, I would even find a copy somewhere on my shelves. It's actually available also online, so it's a PDF, so it doesn't have to, you know, but we do have a lovely publication that was printed a couple of years ago with such stories, about 50 or so stories, obviously many, many more since then. But you make a very valid point. These are real people, with real stories that will literally touch your heart. And I'm sure they will touch his heart too. And looking at it from that point of view, looking at it from a personal point of view, imagining that that person is your sister, or your sister, or your aunt, or even your mother, if you're young enough, will completely change your perspective, completely. And we see this quite a lot in our clinics. You know, people would say, look, I was against abortion under all circumstances. I'm totally anti-abortion. But this happened. And now I feel differently. And now I understand why people make these decisions. So I agree that looking at it from a compassionate point of view, and let's not forget, he's the Minister of Health, from a health point of view. Which is why we're focusing on the decriminalization of abortion. We would like it to be legalized, but at least let's begin with decriminalizing it. At least for women, or for anyone who can get pregnant. Let's not forget, it's not just women. Let's at least decriminalize it for them. We do understand that doctors, myself, and others will remain criminalized for providing the abortion pills. So the abortion pills would still we would still not be able to prescribe them here. In any case, they're arriving at the rate of, 10 or so a week in the mail. So, we don't need to worry about that. The supply line is working. But if women knew that if they had any complications, they wouldn't need to go to the hospital and be afraid of going to the hospital, or rather, if they needed to, they wouldn't be afraid of going because they might be reported, that would change. That would change the whole dynamic, and then slowly we would move into an area where people would understand that this is a normal healthcare procedure. So yes, I think we should not be criminalizing the women. We can keep the actual act illegal if you want, even though I'd rather we didn't. But in the beginning, there's nothing stopping the ministry from doing this, right? The government, rather, from doing this right now. Because the reality is that the law is not working.
So we spoke about the health aspect and the personal aspect, but there's also the policy aspect. Dr. Ploumen, you were the Dutch Minister of Foreign Trade and Development Cooperation between 2012 and 2017. So you have expertise in economics and policy. How would a robust and comprehensive policy on decriminalized or legalized abortion affect a country, positively or negatively?
Well, I mean, there's lots of statistics from the World Bank, the UN, national institutions that testify to the fact that if women can decide for themselves if they have children and how many children they have, that greatly benefits any economy, because if you can avoid teenage pregnancies, for example, girls can stay in school, they can finish their education, they will be very qualified when they enter the labor market. And so on a personal level, that is obviously important, but it's also very important when you look at it from, the perspective of the affluence of a country. And so to not use the full potential of all the people it's not only a shame for women as such, and like I said, at an individual level, but it affects all of us. So making sure that people have bodily autonomy is also economically very relevant. Yeah.
So you sorry, you're gonna.
No, you go.
I'm curious to know what made you become so dedicated to the cause of inaccessible reproductive rights, considering you come from a country with quite a progressive abortion legislative framework.
Yeah, so our legal framework, I think it dates from 40 years back. I've been a feminist as long as I know, because I saw that when I grew up, so in the 60s and the 70s, that also in my country, women did not have the same opportunities as men, and that there were all kinds of expectations to the role that you had, or the way that you behave, or all these assumptions on what it is to be a good woman and a good wife. So I come from a very Catholic family. I was born and raised Catholic, and my parents were not particularly progressive. However, my mom always had wanted to be a nurse, but she had to leave school after 5 years to work at the farm. And so she told us that at that point she had decided, if I will ever have children, they can do whatever they like and wherever it takes them. If they have to go abroad, that's how it should be. And that's what my parents basically did. So they were really, my sister, my brother, and myself, they really, gave us a lot of confidence and helped us, educate ourselves and do whatever we wanted. But that was not true for everyone. Sorry. And then, so when I was in my 20s, in the Netherlands, there were not so many women in the public domain. So you didn't have a lot of female politicians, you did not have a lot of female business leaders, for example. And so there, even if, the legal framework was quite progressive, that didn't, and we still also have unequal pay. So in the same job, with the same qualifications, for the same number of hours, women also in my country get paid 14% less than men. So when I grew up, that was even a bigger gap, so to say. And so all of this taken together, obviously one never makes like a decision like, from today I'm a feminist. But at one point you think, this is who I am. And I also think that it's also because I think, of course it's good to change legal frameworks and change policies, but it also has to do with the way that society talks about gender, about what is expected from people, and so it's also a cultural issue, I think, and for that it's really important that we change our attitudes. All of us. Prejudices are not, we all have them, but we have to be able to look them in the eye. And so,
It's very refreshing to see a politician be so outspoken and vocal, because in Malta, as I'm sure Dr. Stabile can attest, our politicians are very afraid to speak about abortion. When there is a politician who's against it, but there are few, and quite a few, that are pro-choice, but you will not hear it, you won't know about it. What is your take on this, and do you have any kind of advice to these types of politicians who may be afraid?
Yeah, so I mean, I'm not from Malta, so I'm always also conscious that, you know, I don't know all of the context. So I don't want to be, you know, I don't want to call on people without knowing all of, you know, the context. Having said that, so I personally, when I was a politician, one of the things that I really, really appreciate and that I sometimes miss, now I'm not a politician anymore, is like the platform that you have to be able to speak out. And by speaking out, you don't do it for yourself, but you can then also, it's a message to people and people can relate to you. And because if a minister says something, you know, some people might feel that, you know, if she says it, then I can say it, or I can speak up, or I can, you know, address an issue. And so, of course, in every country, there's like issues where as a politician, you know, they're like uncomfortable, or you know that you're not going to win elections with them. But still, some issues are so fundamental, can be so fundamental to you that you feel like, you know, I can't hold back. And also this issue, I think, it's on the one hand, it's very personal, all the decisions that you make, the reproductive, sexual and reproductive options that you have and the choices that you make. And on the other hand, it's also part of universal human rights. And so I really felt it was, I never hesitated, or I never thought to hold back. And so I do think that sometimes leadership also means that you say things that might not be accepted yet, but by saying them, you can comfort people and open up a conversation about them.
You're also the founder of She Decides,
right?
An organization. I know that the organization came about as a reaction to something that Donald Trump said. So first, I want you to give me a brief overview of the creation of your organization and what your organization is, and also Trump's potential effect on the international approach towards abortion, and whether you're concerned about that at all.
Yeah, so when Donald Trump was elected the first time, President of the United States, he reinstalled the global gag rule, which means that there was no US funding anymore for organizations that were also involved in giving information on abortion or providing abortion services. And I knew that, and I mean, there was lots of data about that available, that would affect millions of women and girls, because also these organizations give information, give contraception, and all that would also be seriously hampered. And so I thought, what can we do about this? Because I didn't want to, you know, leave the women without any funding for the organizations that they care for. And so I decided to try and close the financial gap, not on my own, but of course the Netherlands put in money, and I called on other governments to join us, which in the end I think more than 80 did. And it was more than 400 million euros that were like dedicated. And so it helped maintain certain services. And it also showed how important it is if you can organize and if you can make people understand and have a debate on why this is so important. So in the end, there were foundations that contributed, countries, people like all of us. One woman went to the Dutch embassy in Washington and gave an envelope with $5 saying, you know, sorry about this, it's our doing, but please, thank you for taking up this issue. And so, it was really, I think it was very important to give to say, listen, I mean, this is what you feel in the United States, fine, he's a democratically elected president, and we feel that this is not the way that it should be, and we want to support women and girls. Yeah.
Well done.
Yeah.
Thanks.
We are very proud of you there.
Thanks. Yeah.
I'm going to squeeze in one more question. Or
No, go ahead.
So obviously, like you said, conversation and discourse is very important because abortion is considered a fundamental right. On the one hand, it's considered a fundamental right, and on the other hand, there's this kind of balancing within the international community of sovereignty. And this is something that the EU kind of grapples with a lot, right? Because there's a parliament that wants to inscribe it in the Charter of Fundamental Rights, but it's something the Council would never agree with. How can politicians or people in general deal with this dilemma?
Well, I mean, I would not call it a dilemma because there's, of course, there's state sovereignty, and countries can also, I mean, democratically elected governments make their decisions. On the other hand, there's also, I mean, there's the Universal Declaration of Human Rights. There's many treaties that kind of reinforce the right to health and to not be discriminated against. I would say the right to bodily autonomy. And so I would suggest that is like, that can be the backbone of your policy. And then, of course, every country, the way that a law plays out, I mean, that's for every country to decide. But I do think that, I mean, I consider it to be a universal human right to decide about your own body.
Yeah. And I have a question for the both of you now. Do you have a message to Maltese activists who maybe feel tired of fighting what feels a bit like a stagnant fight in Malta when it comes to reproductive rights?
Yes. I think the message is we're not going to give up. We're not going to give up because, well, first of all, we can't. Okay, we've already made great strides. And of course, it always helps to have international support. It really does. We've already made amazing strides. 10 years ago, 5 years ago, we couldn't speak the word abortion. And now here we are talking about it openly, having a debate on campus, having interviews online. I mean, clearly the matter is now in the public domain. So we must not give up, and we will not give up. Even though it is tiring, it's hard work. And it is demoralizing sometimes, I won't deny that. But whenever we actually meet women who are having abortions and who need help, that's when you realize that what you're doing is really important.
Yeah, and I've been really encouraged by, the activists that I met these days, also because all generations are there. And I think it's like you said, it can be tiring sometimes, but change never happens overnight, and sometimes it takes a long time. But in the course of making the change, many people are will be included in the conversation, and I think that's really important to kind of. I mean, this is a collective issue. It's not of an individual woman or an individual daughter. It's about all of us. And then to have that conversation, I think, is part of the change.
Yes.
And
yeah, absolutely. Thank you both so much.
Thank you.